Here are some important facts on sexually transmitted infections. Sexually transmitted infections, also known as STIs or STDs, are mostly spread from one infected person to another through sexual intercourse. Some infections may also be transmitted from mother to child during pregnancy and childbirth. Another way that infections are passed on is through the sharing of blood products such as needles or through tissue transfers. Some diseases caused by STIs include syphilis, AIDS, and cervical cancer. STIs often exist without symptoms, particularly in women. Thus, men and women with sexual partners who are experiencing STI symptoms should seek care regardless of a lack of signs. Whenever an infection is diagnosed or suspected, effective treatment should be provided promptly to avoid complications. STIs disproportionately affect women and adolescent girls. Every year, 1 in 20 adolescent girls gets a bacterial infection through sexual contact, and the age at which infections are acquired is becoming younger and younger. Improving awareness and knowledge of STIs and how to prevent them among adolescents should be part of all sexual health education services. Sexually transmitted infections are important causes of fallopian tube damage that lead to infertility in women. Between 10 and 40% of women with untreated chlamydial infections develop symptomatic pelvic inflammatory disease, also known as PID. Post-infection damage of the fallopian tubes is responsible for about 30 to 40% of female infertility cases. In pregnancy, untreated early syphilis is responsible for 1 in 4 stillbirths and 14% of neonatal deaths. About 4 to 15% of pregnant women in Africa test positive for syphilis. Interventions to more effectively screen pregnant women for syphilis and prevent mother-to-child transmission of the disease could prevent an estimated 492,000 stillbirths per year in Africa alone. One of the most deadly sexually transmitted infections is the human papillomavirus, also known as HPV. Virtually all cervical cancer cases are linked to genital infection with the virus. Cancer of the cervix is the second most common cancer in women, with about 500,000 new cases and 250,000 deaths each year. The new vaccine that prevents the infection could reduce these cervical cancer-related deaths. And when used properly and consistently, condoms are one of the most effective methods of protection against STIs, including the HIV infection. Although the female condom is effective and safe, it is not as widely used in national programs because of its higher cost when compared to male condoms. The partner notification process, which is an integral part of STI care, informs sexual partners of patients about their exposure to the infection so they can seek disease screening and treatment. Partner notification can prevent reinfection and reduce the wider spread of infections. Now, in review, please remember these 3 important facts. Always be protected when engaging in sexual activity. 2. Get diagnosis and treatment for any suspected STI. 3. Please always inform your partners of an STI so they can seek treatment and prevent infecting others.